For over 43 years, Eleos Wellness and Support has provided compassionate mental health support, helping our community find hope, healing, and a brighter future. And of course, in coordination with the Central Florida Behavioral Health Network, we're so happy to welcome back Alan Davidson, and now from Eleos, Chloe Gatton, as well as Michaela Bay. Welcome to you all.
Thank you.
You know, I've gotten to learn about so many organizations that are doing great things in the community, but it's you and your organization that helps make it happen, right, Alan?
Sure, yeah, we're a managing entity. We're one of 7 in the state. We're the largest in population, the second largest in landmass, and we fund a variety of services from mobile crisis team, crisis care, detox, outpatient care coordination. And one of our providers doing amazing work in Pinellas County is Eleos Wellness, and we're just proud to support them in all the stuff that they're doing over there, trying to keep people and get the help that they need.
And I feel like the help that people have needed in the past, it has changed as we have learned more about addiction, behavioral issues. What are you able to do to really facilitate the changes that are necessary to get those onto the road for recovery? Chloe?
Yeah, we operate 24 hours, 7 days a week, so we're always available for clients throughout the Pinellas County. We respond to their homes wherever they are in the community to make care accessible, and we connect them with outpatient support or, when necessary, assess for crisis stabilization.
And of course, I know there's a mobile element that I want to get to know, because there are some people who may refuse to go into treatment or may have, you know, transportation issues and be in an opioid-related crisis. Michaela, how are you able to really make a difference there?
So when we respond out to people and we assess and realize that there is an opiate-related aspect to the crisis they're experiencing, if they're unwilling to go to the hospital or unwilling to seek the treatment that they do need, if they are unable to make that decision for themselves, then we would initiate a Marchman Act. If they are refusing treatment, they have every right to do so, and they're not at that point in their life or at that point in their addiction where they're looking for treatment services. We respect that right, but we also provide them with the resources in the community, education on opiate addiction, Narcan, and stuff like that, so that when they are ready for those services, they know where to find us.
It's interesting that you talk about that. I feel like, you know, so many times we do talk about recovery and what's able to happen, and that's like step 3, step 4. You are able to address that step 1, and it really seems like that unique way you've been able to help a lot of people right now.
Yeah, absolutely, and especially if the client isn't ready to seek care and they're medically stable, we continue to follow up with them and encourage them, and we don't judge them. We want to promote autonomy.
Absolutely, that is so important. I'm so glad resources are out there like you, and then of course, this just fits the backbone of what you hope to do, right?
No, absolutely, absolutely. Again, like they said, sometimes people aren't ready to go in. They want to be in their home, and they want someone to come to them. And this is where this service as a mobile crisis response team fits in.
Well, thank you for introducing us to Eleos. I'm glad to learn more. And as always, we want to share the important information. If you or someone you know needs help, there are some websites. And then again, that mobile crisis phone number, that really is important. So there it is on your screen as well. Thank you to all of you.
Thank you for having us.